when you're moving from place to place, place. Good morning, good morning, morning, good morning, morning.
Can save your life.
5, 4, 3, 2. Hi ladies, cervical cancer is one of the most preventable cancers.
The HPV virus is one of the major causes of cervical cancer. Did you know that vaccination can save you from HPV? With regular checkups and vaccination, you can prevent yourself from getting HPV and cervical cancer. If you don't know this instrument, get familiar.
Here now, everything in life is manageable. So cervical cancer is preventable. This is not a smear campaign. I'm telling you with ease. Make sure and do your pap smear them for me, please.
There are two types of pap smears, conventional and liquid. Both test for the abnormal cells of the cervix. But the liquid one can test for both abnormal cells and the HPV virus.
Mis mujeres, por favor, no se esperen. Háganse su prueba de Papa Nicolau cada 3 años. El cáncer de cervix es prevenible.
Il est conseillé de commencer le dépistage à partir de 21 ans et de le refaire jusqu'à 65 ans. Une fois les résultats sont normaux, il faut le refaire tous les 3 ans.
A pap smear can literally save your life.
A pap smear can save your life.
A pap smear can literally save lives, woman.
A pap smear can literally save your life.
If you're sexually active, you're above the age of 21 and you haven't had a smear within the last 3 years, then you need to get yourself checked out.
Viewers, welcome back to Tobago Updates Morning Show. We are here in studio with Dr. Shauntelle Winchester, also known as Dr. Win. She has various TikTok videos on her TikTok page talking about OBGYN related issues, and she's here in studio to talk about Cervical Cancer Awareness Month. Good morning and welcome to you.
Good morning.
Now, Dr. Win, what is the main message outside of Cervical Awareness Month that you want women and families and the general public to take away?
So cervical cancer is one of the most preventable cancers, and it can be prevented by having regular screening and just checking up on your bodies. Because it is preventable, I am here advocating for women to get regular screening and vaccination so that this cancer can be eradicated.
So you said cervical cancer is one of the most preventable ones through screening. How much screening does the TRHs see coming from women coming to get screening? Is it at a level that you are satisfied with? Is it high? Is it low?
Well, at this point in Tobago specifically, I don't think that the screening uptake is where it should be, because we are still diagnosing women of cervical cancer. We should reach the part where we have eradicated cervical cancer totally. Countries where you have a high vaccination uptake and regular screening, such as in Australia, Saudi Arabia, and Japan, they have no cervical cancer cases. Yeah.
Wow. Wow. I've never heard that before.
What exactly is cervical cancer and how does it develop over time? I think some people think that won't happen to me. I am relatively healthy. I may not be doing certain things. So I don't think that would happen to me. So explain to the viewers, those who are looking on, what is cervical cancer and how does it develop over time?
Okay. So cervical cancer is cancer of the cervix. The cervix is the lower part of the womb. So the cervix is here, and it opens up into the vagina. So these are where the abnormal cells will develop. The primary cause of cervical cancer is actually the HPV virus, the human papilloma virus, and that's what the vaccine protects against. But it is the long-standing virus. So most of us, because of our immunity, we can't clear the virus. So most of us would have been contracted HPV virus before, but the body has the ability to clear it. So it's the long-standing HPV virus. Cervical cancer is a slow-growing cancer. It takes about 10 to 15 years to develop. So That's why the screening is important, because you can't catch it early. But it is HPV virus is primarily the main cause of cervical cancer.
So because of this 10 to 15 year slow growth, and it's, well, you're saying this the long-standing HPV virus, which means it's a particular strain of HPV, if I'm correct?
Well, there are over 200 strains of the virus, but it's the high-risk strains that causes the cervical cancer. And may I use this opportunity to say that HPV virus doesn't only cause cervical cancer, it can cause penile cancer, anal cancer, and also throat cancer.
Okay. And those cancers are also slowly developing cancers as well?
Yes.
So this 10 to 15 year period before it becomes, I guess, fatal in persons, it kind of shows that persons aren't going for their screenings at a regular intervals.
True, yes. And also, early stages of cervical cancer, most times you don't get any symptoms. So you honestly would not know that you're having the precancerous changes or that these cells have begun to change. So most times persons present to us is because they have the signs of cervical cancer, which are abnormal bleeding, primarily bleeding after sex, odor, vaginal odor, pelvic pain, back pain, but by that time it would have already spread.
Now, I know we've spoken about screening, but we didn't go in depth to what the tests are like. So share with the viewers and the women looking on, what are some of the tests that they can take to screen for cervical cancer?
So there are actually two screening techniques. There's the pap smears and there's HPV testing for the presence of the HPV virus. So most women will know this instrument. This is a plastic speculum. It's a small plastic speculum. And how we use it, it is lubricated for ease of comfort, and it is inserted into the vagina and opened up. We look through here in order to see the cervix. There are two types of pap smears, as seen in the video before. There is the conventional pap smear, and then there's the liquid pap smear. This one can test for the HPV virus. So it's a simple test. All it takes is about 5 minutes, and we go in and we take samples of the cells, put it onto the slide, and send it off to the lab. Easy squeezy.
Okay, so I know a lot of women talk about the levels of discomfort, but some persons may say it's a painful experience. Is it painful?
So I would say, honestly, it is an uncomfortable experience, but it's not painful. It takes about 3 to 5 minutes, and that 3 to 5 minutes can literally save your life.
Yes. We were talking about HPV, and that HPV causes cervical cancer. I know that there is a vaccine for HPV.
Yes.
Some years ago, they were trying to implement the giving young girls the vaccines, but a lot of pushback against, particularly denominational schools, were pushing back against the vaccines. What is the participation, for lack of a better word, like in terms of women coming forward to get the vaccines?
So currently, the participation is not where it should be, but because of educations and talks like this, more women are coming forward to get the vaccination, and that's a good thing. Ideally, the vaccination should start before you become sexually active, so that you will be prepared. You will be protected against this virus. And it is given, well, at that point in time, it is offered to boys and girls. Because again, remember, the boys, they are carriers of the HPV virus, and they can get the penile cancer, they can get uropharyngeal cancers as well. The vaccine, though, protects against the high-risk strains of this, the dangerous types of this cancer. And the earlier you get it, before you become sexually active, will actually prevent you getting this this vaccine.
Now, if the results from screening comes back as abnormal, does that automatically mean cervical cancer, or are there other underlying issues that can result in an abnormal result?
That's a great question, because yes, we are pushing for pap smears and screening, but a pap smear does not screen for cervical cancer. What it actually screens for is the abnormal cells before it goes on to cancer. And if your pap smear comes back abnormal, it's not a death sentence or anything, because it can be treated.
Okay. Where can persons go to do their pap smears and also do the other testings?
Yeah. So the Pap smears are available at your local health centers for free or at a cost at your private doctor.
Now, Dr. Wynn, we want to thank you so much for coming on this morning and giving awareness about cervical cancer, not just for women, but for the men in our lives, but also the community at large, because we often hear about cervical cancer and we just think women, which is what we should do. But in terms of the HPV virus and going a bit more in depth and showing how it can translate from the man to the woman, it shows that it's a collective responsibility. I want to thank you so much this morning for coming on and share that with us. If you have any final words that you want to share with the public before we wrap up.
Sure. So what I'd like to say is that women, cervical cancer can be prevented, and it can be prevented through regular screening. I know a lot of you think that this is painful, but it is just 3 to 5 minutes that can literally save your life. So if you've never been screened before or you're lacking on your screening, please go get screened.
One last question. I know we said we're wrapping up. I wanted to ask is, you said it's better to get the vaccines at a younger age.
Yes.
But is there any age limit at all to getting vaccines? Can you get it anytime in your life?
You can get it up to age 45.
Okay.
You can get it up to age 45.
All right, we want to thank you very much, Dr. Shauntelle Winchester, for coming in and speaking to us about Cervical Cancer Awareness Month this January. Viewers, unfortunately, we have come to the end of the Tobago Updates morning show, but our programming continues. We have Good Morning Tobago up next with Chanel Felix. So do us a favor. Share the live, share the live, share the live. GMT is up next.
Put a smile on your face when you're moving from place to place. Good morning, good morning, morning, good morning.